Hello, Benny. How you doing?
Oh, good. Thank you. Yes, thank you for having me.
Oh, my pleasure. My pleasure. So, Benny, I want to ask, in your 15 years of being a psychologist, what could you say is depression? What is anxiety in the simplest terms?
I would liken depression to be, it's interesting, it's almost like a crushing weight or even a numbness. Or for some people, they can oscillate with quite a lot of irritability as well. Yes, but it's generally a sense of feeling very low for a really long period of time, and also just a lack of interest, in what they used to enjoy. Yeah.
And how would you describe anxiety in the simplest terms?
It's almost like if you looked at things according to levels, depression is something that's low, whereas anxiety is kind of high. Like it's this running around like a headless chook, and that racing mind, and that critical voice, feeling judged, judging themselves, a sense of just constantly being on edge. Yeah.
I've heard a lot from people in my time that they've got high functioning anxiety. Do you believe that's a positive thing?
That's actually quite interesting. I don't think anybody who has experienced anxiety would call it a positive thing per se. It's an exhausting thing for many people. And I think the term high functioning can be subjective.
Yeah.
Because, people from externally looking in, like, this person's got a job, they're looking after their family, they're running businesses, they're high functioning. But if a person has a disability, has to deal with complex health systems, struggling with, comorbid conditions, but they still get up each day and try and have a bath and have a meal, could we consider that functioning, high functioning, considering what they are going through?
Yeah.
So, yeah. I'm not sure if it answers your question.
No, it's good. So, Bernie, in your 15 years of being a psychologist, what would you say are some telltale signs that someone who's going through depression needs to start thinking that they should actually go get professional help because it's getting in the way of their day-to-day life?
Well, actually, you've hit that nail on the head. It's getting in the way of their day-to-day life. A lot in my circles, and I have quite a large community of psychologists, we do talk a lot about early prevention. So it's better to try and get some help and care earlier on rather than later. But to directly answer your question, I guess it's when you're realizing that your emotional state is really starting to impact your cognition, like the way you think, it's starting to affect your mood, you're finding it harder to regulate. It's starting to impact your relationships. At work, activities of daily living, just like getting up, making breakfast, taking a shower, doing your laundry. Like, if these things are starting to get progressively harder and harder, that is a sign, yes.
It's interesting, like being a father myself, you're having to teach your kids how to brush their teeth and be consistent and whatnot. And then over time you develop those skills yourself, that it's a natural ability. But then I've noticed that in some people with depression or anxiety, they can't even wake up in the morning and brush their teeth and get started with the day, and they can't even nail the start of the day, how they're going to finish. So what are some tips for people who are going through a really tough state at the moment and how to get started, to get kick-started on their healing journey?
It's actually interesting because I think in psychotherapy, we try and work with people on multiple levels. And what I mean by that is intra-psychically, so within themselves, to kind of rebuild their relationship with themselves. So some people are like, they discount themselves, but they care about everybody else. And it's an internal shift that, hang on a second, maybe I have value as well. So it's about working within, so that's one level. But there's also the interpersonal level. And so I look at it from a biopsychosocial lens. And so that social aspects, are they in an environment, it could be a work environment, family environment, where it's not particularly conducive for their mental health? And, maybe could they learn boundary setting, advocate for themselves or their needs better, relate to others better? So that's that second level. And then there's also the third level, which is around working with or living with systems and their relationship with family, relationship with culture, because some people do face like chronic discrimination, as an example, or how they see the world. Is it a safe place or not? Or for especially some of the younger people coming up, climate change fears and that kind of thing, and how to relate to that. So it's on multiple levels again. Yes.
So one question in particular that I've got to ask, I noticed that for cultures like in America, everyone seems to have a counselor, a psychologist, or a psychiatrist. It's pretty ingrained in their culture that everyone's got problems and they see someone about it on a regular basis. But in Australia, it's not that common for people to really talk about seeing someone professionally. What are some moments where you think that someone should start talking to a professional about their situation? What would be a key indicator that someone should go seek professional help from a psychologist?
So I'm from Singapore. So I hail from Singapore. I'm a migrant into Australia, and I've been very blessed to have been welcomed by the Australian community. So I really felt welcomed. And there's a general culture of she'll be right, or like I've got to manage this on my own. There's a very strong and independent streak I find in a lot of Australians, and it might take a while to kind of get over the idea that it's okay to ask for help. It's not a sign of weakness, although, yes, I can see a lot of my clients saying to me, no, Bernie, it is. But and maybe for some of them, they have felt that they had to hit rock bottom before they actually seek help.
Yeah.
But I think for a lot of people, so coming back to your question, it's that they usually have a point, a realization, and it could be they're working on something and suddenly they're yelling at their kids at an extremely high decibel, and the child starts crying, and in that moment they're going, what have I become? That there's a moment, or they start breakdown crying in their manager's office when they've never cried in front of their manager before, and that's the moment, oh, hang on a second. Or they've just finished eating an entire tub of ice cream.
We've all been there.
At 2 a.m. in the morning, and you're going like, what did, usually it's these moments, you get the moments and you're like, or they might have a loved one that really cares about them and holds their hand, looks into their eyes and says, please see somebody. that might be the moment that they need.
I've touching on like the culture of it even more. There's someone close to me who I said it would be wise to talk to someone professionally about this instead of just a family, because often your friends and family aren't equipped with the right knowledge or the skills to help you navigate through certain situations in life. But the response was, "But I'm not crazy." So does it take you to become crazy per se to seek professional help, or would you even suggest going when you don't necessarily have anything wrong at all, just to sort of help, self-evaluate your life and how you sit into the space?
Yes. I'm a big fan of therapy. Big. And the beauty of it is there are so much options out there. And yes, psychologists are very trained in mental health. But I would also say that we have quite a lot of diversity. There are professional counselors, there are mental health social workers, mental health nurses, there are psychiatrists. And there is a lot of help out there, really. And there's a concept called bioindividuality as well. So each person is unique within themselves, the brain structure and stuff like that, and the connections, but also unique in their lived experience and situations and family, and so you might need to find the right fit for you. Yep.
So from a personal point of view, I didn't really touch in. I never, from a personal point of view, I never even thought about going to see a psychologist. It was only until I got bariatric surgery 2 years ago, where you physically have to go get it as a part of the approval process of getting the surgery, because it's a irreversible
significant- yes.
life surgery.
Yeah.
And my first appointment with the psychologist that I had originally, it was actually not a positive experience, and that sort of put a bad taste in my mouth. But it was until 4 months later I had the weight loss, and I literally felt the weight off my shoulders. I started to notice there was a continuous pattern of where I felt happy, and it was an unknown feeling without having the highs and the lows in my time. And that was in the moment where I thought, maybe I should see a psychologist about this and sort of get a baseline to see who I am now versus who I was before, and who am I going to be in the future. Do you see this how regular do you see people checking in with a psychologist before things start to break in their life?
Quite rarely. So actually, Luke, you are a rare gem there. And I would say, you've got quite a lot of insight, I think, and quite reflective. Yes. So you might be a prize client for a lot of mental health professionals. They'll be like, yes, we want Luke. But it's interesting you say that, because I have training in health psychology, and there are actually many different types of psychology. So clinical, educational, developmental, organizational, and health psychology is the intersection between physical health and mental health.
Yeah.
And so people like yourself going through quite a large medical procedure like bariatric surgery would be, excellent candidate to see a health psychologist. And others might be, people who are going through cancer and going through a chemotherapy. Or my particular interest is in sleep. So people with chronic insomnia or sleep issues. And yes, that's where it can link up with TMS, but we'll chat more about that over time. But yes, it is wonderful, Luke, what you're doing. Because I think what you're doing is preemptive care. So you're looking after yourself almost across your lifespan, as you change and as you go through transitions. Yeah. So very well done.
Because in my personal experience, before getting psychology, I didn't actually understand that I had depression or I had anxiety, and I couldn't actually attach my feelings to what was happening in front of me.
Yes, it's your normal.
It's not normal.
I mean, it's your normal.
Oh, it's my normal, exactly.
Yes.
And it was only until starting the conversation with a professional and understanding that maybe certain behaviors aren't considered normal, or the way I think. I never actually understood what it meant to have anxiety. And I just thought everyone else is meant to be wired that way.
Yes.
And it's as a simple thing as like you're driving on the road and you see someone do something silly on the road, or they're not paying attention. You go, well, why aren't they thinking of that? They're not looking at this car ahead. They're not doing this. They're not doing that. But obviously those people have a very calm state of mind, and it's not as active as mine. But here am I thinking they should have the same thought process as me. It was only through psychology that I was able to find out that, hey, there's other things happening in the background where you had anxiety, depression, and that's where over time, after maybe like 3 or 4 sessions very early on, that's where they started to identify that I might potentially have ADHD. And once looking into that sort of helped understand certain other aspects of how I operate in my life. One thing I've got to ask is, how does the combination of therapy and medical treatment, whether that be medication or TMS therapy, how do they go hand in hand?
Excellent question. And I was thinking about it from 2 perspectives. So one of it is if we look at the biopsychosocial, spiritual framework aspects of things. So a person might not develop anxiety, depression just on its own. It's usually accumulation of a lot of stresses in their life, and it could be biological, psychological, social, spiritual. And I would see, and this is from my humble opinion, is antidepressant medications. The medications come from a biochemical perspective. They're trying to create some change within a person's biochemistry. Whereas psychotherapy is psychosocial. So there's something about that, being held in a space with another human being, another compassionate, empathic human being, having elements of coaching, learning new skills, learning new things about yourself. And it taps into depression and anxiety from a psychosocial perspective. And alternative, but can be very helpful treatments like TMS come from a neurophysiological approach, and they tap. It might have more like a biological element to it as well, but it can have long-standing impacts flowing on into psychosocial influences in a person's life. Yeah. But how? And is it okay to share an analogy?
Yeah, 100%.
Yes, because I was thinking about this, and so think about it like a car. So let's say we are cars or vehicles, right? And I would see TMS as having the potential, the ability to work on the engine of the car and the fuel and the petrol within it, the connectivity. So there's something about the engine and the brain and the fuel and the networks. And it makes it more efficient. It improves cognitive ability, it can improve sleep as well, and improve emotional regulation. And then psychotherapy supports the car to know itself better. So, am I a sports car? Am I a Porsche? Am I a truck? Am I a four-wheel drive? What type of bumps do I have? Or what type of terrain am I best at? And where is the map for me? Where do I want to go? And you can see how complementary that is. So we have a treatment like TMS that works on a bio-neuroplasticity level, like within the car, on an engine and fuel. And we have psychotherapy coming along, pairing alongside it, to work on better understanding of the type of car that I am, and what accommodations do I need, and what type of roads and terrain would suit me best.
Exactly. I love that analogy. I personally found when it came to getting psychotherapy, I had it for like the first year, and I was very open. It was working great in terms of creating a dialogue. But one thing I found is that I just couldn't embody the feeling of the work I was doing, and like the great work I was doing in terms of communicating with the psychologist and doing the homework and whatnot. Then I found with TMS as an additional form of treatment along with psychotherapy, I was able to actually embody what I was doing, how I was feeling, mind, body, and spirit, rather than just talking the mind and not encompassing it with the body. What is some of the history of your patient's success when it comes to integrating TMS and psychotherapy together?
Oh, that's a beautiful story, Luke. And I think there's something about TMS that primes the person to be ready to take change in their lives. And psychotherapy is almost like a fellow human journeying with you when your soil has been primed already to go.
Yeah.
And I would say that it is quite a good complement. And I would say it's a good complement for a variety of reasons. And I'm going to share now from a health psych perspective. So if we look at TMS as a medical procedure, as an example, sometimes clients coming in are terrified. So they're worried, oh no, is this going to change me forever, or in a good way or not? And Ramo's team of senior mental health nurses, or myself as a established psychologist, supporting them into that journey. The reassurance and the support is helpful as they journey through that. You can have worries and concerns coming up, and it's 3 to 5 sessions a week. A lot of clients will go like, And so it's like, no, come on, there's that health coaching element. You can do this, what is your end goal, that kind of thing. And Ramos' team also helps a lot with lifestyle modifications and supporting that as well. Where do you want to go, rather than focus just on the problem itself?
Yeah.
Because you're rewiring, aren't you?
Yeah.
And then, like all medical procedures, it might not work for, and I'm like, I'm so sorry, but it might not work for everybody. So it might work for a lot of people, but what about the people that it doesn't work for? And so it's good to have psychotherapy on board to hold these people and to let them know, okay, this one might not be for you, but there are many other options. Don't give up. Or it might not be for you now because you've had a range of other issues that might be impacting neuroplasticity. So, chronic or a lot of alcohol use, things that are not very good for the brain, chronic sleep deprivation, although TMS can help with sleep. And working on those, or a lot of psychosocial stresses going on in their lives. And they might say, no, maybe Bernie, I'll pause TMS, work on these other factors with a psychologist, and when I get to a more stable level, go into TMS and continue. So it's about supporting them through that journey. I think that's Ramos' vision, is that it's a holistic care. It's wraparound care. So it's not just we'll stick you in a chair and you 35 sessions done and dusted. No, there's a real genuine care for people.
Yeah.
Before, during, and also after. Yeah, and our psychiatrists are really lovely as well. Yeah.
So if you're at home and you are going through these symptoms of depression, anxiety, and you're really struggling and you've sought out professional help, but you still got to come home at the end of the day and you're reminded about your environment, is there any tips that you could give to that person's friend or partner so they can offer some low-key engagement with the person without feel like they're overstepping?
I would say if you're a family member or a friend of somebody who is living with mental illness, my heart goes out to you. It is not an easy thing to stand by them, but as you stand by them, that is really important. And I remember, Winnie the Pooh, and you remember Eeyore?
Yeah.
And how down and depressed he was all the time.
He needed TMS.
But how his friends stood by him, they just invited him to everything. And he was still included as part of that. And I would also encourage you that, I know it's hard, but try not to take it personally. So it's not necessarily your loved one that is directing their anger or their frustration, irritability at you, although it might seem like it, but it is there is a clouding that comes from the mental illness itself. So it's kind of like, if you are wanting to play soccer with your friend, but they've broken their leg, you're not going to say, why aren't you kicking the ball? You're not kicking the ball because you hate me, it's they're not kicking the ball because they've broken their leg.
Yeah.
And so, but being invited, having accommodations for them, having them being able to sit by the stands and cheer you on, that matters so much. And yeah, so I would say, stick in there, encourage them to get support and know that there is stages of change. So what I mean by that is sometimes the person needs time to be ready to seek help.
Yeah.
But you can plant the seed. That love and care, the consistent love and care matters.
And for those who feel pretty private about their mental health or their illness situations, how would you suggest to that partner or their friends to help build a support network around them? And how would you help them identify that support network around them? Because sometimes people feel when they're in that situation that they're all alone, or they try to isolate themselves so that they don't particularly spread the poison to the people that they know or damage the reputation of who they are in people's eyes. So, like, what are some recommendations in which you could give advice to someone's partner or family member to help the person struggling to build up a supportive network and identify it on a bit of piece of paper, for example, so that when they are going through these times, that they're reminded and they know that they've got the answers and they've got something to go off?
It's a tricky one. It depends on the levels of depression. So, for example, if somebody is very severe and there's actually suicidal ideation or plans in place, then there would be need for a lot more monitoring and checking and support. Highly recommended multidisciplinary care. Have a psychiatrist on board, definitely. And also psychologists yes, there'll be a need more monitoring. But if they're not actively suicidal, but very down, I would encourage family to check in, but also check in on what would work for that person. And if we put ourselves in their shoes, it feels like they're carrying 100-kilo weight on their back. And if you're a person carrying 100-kilo weight on your back every day, you're not really going to want to go to a party and mix with 100 people. They might be better with sitting on the couch watching a show together, or some like Everybody Loves Raymond, or some kind of Netflix show. And each little bit of invitation matters, and also respect when they're saying, "I'm sorry, I can't right now," rather than pushing or criticizing, which you're just adding to the 100-kilo weight. And so you're journeying alongside with them. So ask them, what do they need? What would help them?
So, Bernie, in your 15 years of being a psychologist, why are you getting involved with TMS Hub? Like, where did you come across TMS in your career?
So I was looking for something more. So I have worked with clients for many years, worked with many different psychotherapeutic modalities as well. And for some clients, it's not enough, and it breaks my heart when that happens, because they're really trying, and you can see that they're really trying. And it's almost like there's still a gap. And I think I found it such a blessing when I came across neuromodulation, like TMS, neurofeedback, these types of things, because it gave the client another option. It's not like they're just dropped, like we can't help you, but they have another option. And for those that it works for, TMS is amazing in what it can do. Yeah.
And for those who are going through, so addiction has changed over the years, in particular in the past 10 to 15 years with the introduction of smartphones, the changing the way people smoke cigarettes now to vaping, and the use of alcoholism in our society. In what way do you believe TMS could help, along with psychotherapy, into reducing those addictions and getting a stronger hold on their way of life?
Yes, it's interesting because TMS has the capacity to support people build emotional resilience. And so they seem to, after TMS treatment, be better able to manage emotional states. And I think a lot of people with addictions use it as a coping strategy for quite significant emotional distress. And so if you have a treatment modality that can support them to manage their emotions, it might give them the gap, the space necessary to try something new, to give maybe a more healthy coping strategies a go. Yeah.
100%. In my time, I definitely noticed, in my life, I've worked around alcohol and liquor for the majority of it. And when it came to getting TMS, it was the first time in a long time where I actually stopped looking at a bottle shop sign and thinking, oh, I could go grab a drink. I actually had the moment of actually identifying a thought and having time to process it and actually decide whether I want to action it or not based on who I am in that present time.
Yes, that's the space, isn't it?
That's the space.
Yeah.
And it's wild how, getting the treatment alone, it's great, but being able to back it up with psychotherapy and help putting the words and the terminology and seeing how my behaviors are changing based on the way I'm thinking and managing my thoughts, it's incredible. Where do you see the future of mental health? How do you see the future of mental health changing regarding to seeing TMS being more available to the general public?
Yes, I'm so grateful as well to TMS Hub and Ramo and the team for making TMS more accessible to the public through bulk billing. And I would actually like to see this option of neuromodulation more accessible to the public as well.
How do you see the future of healthcare, mental health care changing in regards to TMS being more accessible to the public? Traditionally speaking, if I've got depression or anxiety, you go see your GP, you might get a script for a specific antidepressant or whatnot, and then you're trialing that. And obviously it takes time, months to really kick in to get the full therapeutic effects. How do you see now TMS being an option for the general public with the use of Medicare supporting bulk billing, especially through places like TMS Hub? How do you see that changing the way the general population getting on top of their mental health?
Honestly and sincerely glad that this is happening. Kudos on the Australian government for being able to do this and offer this, because TMS has the potential again to work complementarily with psychiatric medication, and it also has the potential, and this is research supported, to work complementarily with psychotherapy. We need innovation in mental health. We have a crisis, a mental health crisis. So I say, bring on neuromodulation, bring on psychiatric medication, and bring on psychotherapy, and that we can then finally really tailor mental health to the needs of each individual client.
So Bernie, you've been a psychologist for 15 years and now you're stepping into TMS Hub, being a psychologist there. What can you tell me about the staff at TMS Hub?
I would say that they are very refreshing and sometimes spicy, but overall, what I do feel overall is the genuine care. And this is all the way from Ramo, who is the director of us, and he really cares. From our psychiatrist and our psychiatry team, Kevin, who also cares and gives time to the clients. And each staff member, each senior mental health nurse that administers TMS has their own wealth of experience in the public sector, in the private sector, in crisis care. And so you feel like you're in really good hands when you're there. Yeah.
Exactly. They're not the people who are just turning on a machine, leaving you by and just letting you do the treatment yourself. They're there having a chat with you, making sure you're maintaining the course and ensuring that you are as most comfortable as possible, which is very, very important for people who are going through such turbulent times.
Yes, that's right.